Hello, and welcome to Pursuing Health. I'm Dr. Julie Foucher, family physician and former CrossFit Games athlete. Here, I bring you information and inspiration to help bridge the gap between fitness and medicine and support your journey toward your healthiest self. In this episode, I sit down with Dr. David Johnson. Dr. Johnson is a brain and spinal neurosurgeon who has a pioneering practice in Brisbane, Australia. He's also the co-owner of CrossFit Neuro, the first clinical CrossFit affiliate. Dr. Johnson combines his passion for CrossFit, Olympic weightlifting, neurosurgery, and science to deliver the fundamental message that learning to move proficiently is key to preventing movement dysfunction, which can lead to chronic back pain symptoms. Many of Dr. Johnson's patients go on to become members of his affiliate as part of their recovery process to rehab and to avoid future spine surgery. I first had the opportunity to hear about Dr. Johnson's work when he presented at the 2018 CrossFit Health Conference, and I was excited to catch up with him to learn how his practice has changed and evolved over the years and how he has created a model that is so effective. In this episode, we talk about the importance of addressing the root cause of pain rather than just treating symptoms, and why other factors like sleep, nutrition, and stress management also play an important role in managing and preventing back pain. Before we dive into the episode, I do want to make it clear that this podcast is for general information only and does not provide medical advice. I recommend that you seek assistance from your personal physician for any health conditions or concerns. So with that, let's get started with the episode. Welcome, Dr. David Johnson. I'm so excited to have you here on the Pursuing Health podcast. And, I think the first time I heard you talk about everything that you're working on was at the CrossFit Health Conference a few years ago. And what you are doing in Australia is extremely innovative and unique in terms of taking care of patients especially with chronic neck and back pain, and really focusing on getting to the root cause. So I'm excited to hear a lot about what you're working on, but I thought maybe we could start first with just what led you to a career in medicine and then why neurosurgery.
Well, thank you, Dr. Foucher. Last time I met you at Madison, I don't think you'd graduated yet.
No.
We did cross paths at Madison, but we didn't get a chance to talk too much. But I'm absolutely delighted that you're interested to hear a little bit more about what we do here in little old Brisbane, Australia. As you mentioned, we did talk at the CrossFit Health Summit. And you were at that summit where you heard that lecture. So a fair bit's happened since then with our program for managing chronic spine pain. But to answer your question there, why did I get into medicine? It's just something that I've always been interested in. I originally in high school I was interested in doing veterinary science.
Okay.
And my mum, who's Chinese, I'm half English, half Chinese. My mum said, "Oh, look, if you're going to fix up animals, why don't you fix up humans?" And it sort of made sense to me. Oh, okay, well that sort of makes a little bit of sense. Why, if I have the opportunity to do medicine, why don't I help humans? So that was sort of the trigger to doing medicine. And then I think moving into the surgery side of things, it was always something relating to that immediate fix and that immediate satisfaction. Of course, physicians do amazing things as well, but I think the work of physicians, you have to be a bit more patient, and as you educate people and help people with medical therapy, you've got to sit back and let the body do its thing. And I think I'm a little bit of an impulsive type of person, and surgery sort of gave me that outlet to sort of fix someone in that sense of the word, fix the structural problem, in a couple of hours, and the next day you do your ward rounds and see them up and about and happy, and particularly in neurosurgery, things, life-threatening conditions such as extradural hematomas and intracranial bleeds, where they come in and they're almost about to die, and the next morning you can see them and have a good old cup of tea with them. So that was what was very appealing about neurosurgery. And then spine surgery was a move, not premeditated, but really because it was just such a problem. I would do a neurosurgery clinic, maybe 20 patients in a standard afternoon clinic in the public hospital, and 90% of the workload was neck and back pain. And it's sort of, as I matured as a specialist, I think it just started to dawn on me that the industry as a whole was not doing a very good job with this condition. And then as you move into private practice, there's a lot more accountability for patients when they walk in the door, to provide that service where actually I don't have the opportunity to just say, look, there's nothing I can do for you. You don't need an operation on your spine. But what you do need is this. And the industry didn't really have a standard to sort of redirect people to, because most patients that came to see me, or that still come to see me, will say, I've done everything. I've done the core strengthening. I've done my Pilates. I exercise every day. I do yoga. I'm not overweight. I eat well. All of these things, and I go to a physical therapist twice a week with multitudes of different types of physical therapy, whether that be adjustments or stretching or massage. And I still got pain. And I've still got my pain medication. So I think it really got me thinking and going back to first principles, which is sort of what we learn very early in a scientific career, to focus on first principles and try to make sense of the problem. And often when you go back to first principles in science, you can very quickly unravel what's perceived to be a complex problem. But if you don't go back to first principles, then you can be quite confused and mistake associations for causation, which I think is the biggest mistake in medicine, is confusing association for causation, and therefore then creating an incorrect solution. So going back to first principles with spine pain, you've really got to ask, what is the primary factor that determines joint health, and that comes down to movement. And the spine is just a whole heap of joints stacked on top of each other. And so if the primary factor that determines the health of a joint is movement, why is that not the first thing that we talk to patients about when they come to see us with musculoskeletal pain related to their joint? And that's really how it all started to evolve. And serendipitously, I suppose, I was just starting to get interested in Olympic weightlifting around 6 years ago. And
so you did that before you started CrossFit?
It was all sort of happening together. I was a runner and played tennis and went surfing and cycling, but I was getting a little bit bored, and I was getting a little bit chubby as well, and and then Olympic weightlifting really opened my eyes, and CrossFit, I suppose, to biomechanics, the way that our body is meant to move. It was really quite profound, watching someone lift a very heavy weight, much heavier than their body weight, and they may not actually be the strongest person in the room, but they were the most coordinated person in the room. And so that, I think as a doctor, many doctors sort of don't have that opportunity to see that in reality. They're sort of so focused on the pointy end of the spear, and we sort of drop the ball a little bit when it comes to these really simple fundamental things, and weightlifting helped me with that.
I think it's so interesting too that you said, you went into neurosurgery because you like to be able to really address a problem right away and sort of see the results from it. But yet you have this, you said, unlike the majority of the medical community, you really took a look at a problem that you were seeing really frequently and said, let's really try to dig in and look at first principles and look at the root cause. Is that something that has just been always a way that you've thought about problems, or where do you think that come from, or what allowed you to dig that deep when other people weren't?
Look, yeah, I think that's I sort of consider myself a bit of a fundamentalist when it comes to that, and just having a lot of background education in science, I suppose. When you do years and years of physics, biochemistry, physiology, it makes it easier to unravel problems, and it makes it easier to remember mechanisms and pathophysiology of disease when you focus on the first principles. And I think that's something that we should all, as clinicians, not lose sight of when it comes to disease. And you're a primary care physician now, right? So you're going to see so much back pain.
Back pain, one of the most common, reasons for coming to primary care doctor.
A friend of mine is Amy West. You probably know Amy.
Yes, she's been on the podcast as well.
Yep. We've had lots of chats, and because she works in that physiatry industry, and I think physiatry is a unique to the States, but we would probably call that musculoskeletal medicine. And I think time and time again, I would get letters from either primary care physicians or physiatrists or physical therapists, and every single referral would say, please see so and so with back pain. And like when you hear that, it's sort of over and over again, you start to realize that none of these clinicians have identified a disease process that's causing back pain symptoms. And it seems like billions of people in a World Health Organization considers back pain to be one of the leading causes of disability on the planet. So there's millions or billions of people. In Australia today, there's about 3 to 4 million people with chronic pain. We only have a population of about 24 million, right? So there's a lot of people walking around out there with pain symptoms that have never been given a diagnosis. So just think about that from first principles. If you're trying to treat a disease and you don't have a diagnosis, or if you're trying to treat symptoms and you don't have a diagnosis, the likelihood is that you're going to fail, or at best you might temporize the symptoms. Okay, and that's kind of like putting a band-aid on the problem. If you haven't actually addressed what caused the sore in the first place, the band-aid's going to fall off, and when the band-aid falls off, the sore's going to be bigger. And so then you have to put a bigger band-aid on.
With more side effects or more.
Yeah, exactly. Or a more potent band-aid. And eventually that final band-aid for people becomes the surgery. And it becomes the surgery. And it's a real misconception that people have, that when they get so bad with their symptoms that they need surgery, that they think that this final surgical band-aid is going to cure them. And they're so disappointed, and the industry itself doesn't realize that when someone has spine surgery, well, they do realize, but they're sort of not addressing it. They don't realize that when someone has surgery for back pain, it's like flipping a coin. There's a 50-50 chance that you have major spinal surgery that probably costs 50,000 Australian dollars, bone graft and pedicle screws and fusion devices, huge prosthetic revenue, that there's only a 50-50 chance that it's going to work. And that all comes back down to the fact that it's a band-aid that hasn't addressed the underlying reason why someone's in pain in the first place. Okay, so and all medical problems, all conditions, you know, if someone comes to see you with a headache, you don't just say, oh, they've got headache syndrome.
Right.
You go, all right, well, you've had this headache for 3 months now and it's getting worse and it's interfering with, I think we better look for the diagnosis. We can't just call it a headache. So you might order a scan, you might get a brain scan, or you might do some blood tests and, you know, address what's causing the headache. And then when you do your MRI scan, there's a meningioma in your head and it's causing swelling. And now you've got a diagnosis, you've got a meningioma. So you need to treat that diagnosis with whatever it may be. And the same with back pain or neck pain. If we get a diagnosis, and there usually is only, for the vast majority of people, there is really only one diagnosis for back pain, even though there's a lot of downstream sub-diagnoses that you can layer on top of it. But there really is only one diagnosis. And I think this is what distinguishes and what I would like to see develop globally in the industry with primary care physicians first and foremost, is giving patients a diagnosis of what I've coined as movement dysfunction.
Yes.
We need to get that term, we need to get that disease into the medical textbooks of medical students now. We need to get it in, into the journals, because if a patient comes to see you, Julie, and they say, I've had back pain, it comes and goes, you know, maybe every year I'll get 3 or 4 bouts of pain, and I'll have to take some anti-inflammatory and have a couple of days off work, and then it gets better again naturally because inflammation subsides, and then they go back to work, but then it comes back again. You can now say to that patient, okay, Mrs. Brown, you've got a disease called movement dysfunction. And if I address movement dysfunction, you've now cured her, essentially. You've now cured her, because if she gets appropriate therapy from someone like Amy or who understands movement, then she's cured her problem, and she won't get relapsing and remitting episodes of pain, which is absolutely key, because every time you have a flare-up of back pain, you run the risk of developing chronicity, and by chronicity we mean you know, constant pain for more than 3 months. And the reason
nobody wants
why
to live with that.
No, it sort of overwhelms your life. It completely destroys relationships, destroys work, just takes all the quality out of your life. You sort of, patients sort of think, they say that they tell me they can't play with their children. They go from, their day consists of, when is my next painkiller? When is my next tramadol, or when is my next anti-inflammatory? Because I know I can only have it 3 times a day, but as I'm reaching that point where it's due, I'm now starting to get really, really restricted.
Well, and that's no way to live. So so after identifying that almost all of this chronic back pain is coming from movement dysfunction, can you talk about now how you are addressing movement dysfunction and how you're helping people to really reverse that root cause for their back pain?
Well, yeah, you know, a normal consult for me would be sort of 45 minutes, which is a fairly long time for a specialist consult. I get envious of my colleagues who say, 10 minutes maximum, because in and out the door. I don't know how long your consults are in primary care.
That's funny, because ours in family medicine are really short, and I'm envious of the people who have longer ones, because there's never enough time to address all the different concerns in 15 minutes.
it all comes down to your secretarial stuff, doesn't it? Like how much time they allot for you. So I'm allotted 30 minutes, and usually I'm running, an hour late, because the first half of the consultation is the most difficult with a chronic back pain or neck pain patient, because it's the sort of unpacking of all of the misconceptions that they had about their back. They'll say, look, my mum and dad had back pain, so I've got back pain. It's because I'm getting a bit older. I know I should exercise more. I've got bulging discs. I've got degeneration. I've got arthritis. I don't do any core strength. I've got a sedentary job, or I've got a really physically laborious job. So, take your pick. Which one is it? And often, someone who's overweight will say, yeah, no, I've got to lose a few kilos. But I say, hang on, stop there, because the last patient I saw was really skinny and they had back pain too. And then someone who's elderly will say, it's because I'm old. And I say, hang on, stop there. The last patient I saw was in their 20s. Okay, so it doesn't make sense. It's not scientifically correct. The judgments that you're putting, the assertions that you're making as the cause of your pain are wrong. These are associations. And the one thing that is common to all of you is movement dysfunction. And then once you get past those hurdles, because they've really been so entrenched in their minds by the industry, those ideas that completely neglect movement dysfunction have been so entrenched in their brain that it takes a long time to unwind them. And sometimes patients actually even get a little bit frustrated. They say, so you're telling me that my amazing therapist who I've seen every week for the last 5 years is wrong? I said, well, ask yourself why you've been seeing them every week for the last 5 years. If you were seeing them every week for the last 5 years and they were doing the right thing, you wouldn't know them that well. You would have seen them. You would have seen them for 2 months, and then you'd be cured, and you'd never have to see them again. So sometimes you've just got to sort of work your way around people's personalities to be able to make them have that light bulb moment. And once you allow the patient to make those connections, they're cured. It's just a matter of coming and seeing our movement therapists at our centre. And after a short period, around 8 weeks is our program duration, 8 weeks, and we see them twice a week for 1 hour. And after 8 weeks, they are moving quite well. They're moving quite well, and they can immediately feel like they might not have zero pain. A lot of people do have zero pain after 8 weeks, but after 8 weeks, they can feel that they are on the correct trend. Okay, so that's really important. They're on the correct trend line, which means that as they keep moving well, the pain slowly gets less and less and less.
And how is what the movement therapists are doing, how is that different from what someone might experience at a traditional physical therapy appointment like we might prescribe here for back pain?
Well, just about every single patient has been to your conventional physiotherapist. Like, when you drive around your local streets and suburbs and town, you will see different studios that focus on back pain and whether it be chiropractic therapy, Pilates, they've all done that. And the one thing that they have never done is being told, it's basically, what is the definition of good movement? So that's a really important thing. If you're going to teach someone how to move well, you have to have a definition of good movement. And if you don't have a definition of good movement, then how can you teach it? And I've given lectures to to physical therapists, and I just say at the beginning, put your hand up if you have a definition of good movement. And these people are working in the industry, and not one hand goes up. So remember that's what we primarily have to fix, right. And yet we don't have a definition. So it comes back down to how, as a you would know, being a level 1 instructor, level 2 instructor, how do you teach someone to pick up a barbell? How do you teach someone to swing a kettlebell or do a nice back squat, a nice front squat, nice wall ball, squat therapy? And those, without you even knowing it, as a functional movement or a CrossFit coach, you're instilling the principles of good movement for the whole body. It's not even just the back. It's actually their knees, their hips, their ankles, their shoulders, their neck. So that's another thing that happens to patients, is that they come to see you with back pain. They're not worried about their niggly knee pain or their niggly hip pain, because that's minor. But once you've fixed their back pain, they go, my knee doesn't hurt anymore, and my hips don't hurt anymore. I didn't even come to see you for that.
So you're saving people a lot of other surgeries too, probably down the road.
Well, yeah, good movement is good movement, right? There's not like I'm gonna teach you good movement for your back, but it's gonna destroy your ankle. Right. That doesn't make sense. That means you clearly haven't got you haven't got the right model there.
Right. And by the way, if they're moving well and adding some intensity, they're also getting metabolically healthy and preventing other diseases too.
Yeah, so that's what happens down, when how I said the program's 8 weeks, that's kind of what people start to do around week 7, week 8. So their symptoms settle down, they're moving well, and now they start to build capacity. Okay, so that's the next step, and then going hand in hand with building capacity is that intensity. And guess what they do at the end of the 8 weeks? They go, I love this. I don't want to leave. What can I do now? And so that's how we started to step into the world of CrossFit in the hospital.
Amazing. Yeah. Please talk about that. How did you end up opening? You have one of the first CrossFit affiliates in a hospital, and now you have multiple affiliates, correct?
I believe we were the first clinical CrossFit box in a hospital. I know there's another center in the States, Kaiser or Kersey or Kersley.
Kirby, yes. Kirby, which I think they're more is like an employee, like a box on their hospital campus, and a lot of the employees will use it.
Yeah, so our CrossFit Neuro, that's my waiting room. That's my waiting room for patients. So the patients will come in and they'll sign in with my staff, and then they'll go and sit in the waiting room, which is the box. The waiting room is a 300 square meter box with a rig and wall balls and ring muscle ups, the rings all there. And patients will come down from the ward after surgery, and they'll be seeing my functional therapist and doing hip hinges and good mornings and box squats and wall balls and things like that. And these people are a few days out of surgery, or maybe not having had surgery, just chronic pain, and they're just coming from home, but they're using this CrossFit facility in the hospital for their rehabilitation.
That's incredible.
And one of the things that the common thing that they all notice is that they just say, well, where are the couches? Where are the couches? And that's one of the, I think one of your earlier questions is what's the difference, is that there are no couches, because if you're trying to teach someone movement, the moment you lay them down on a couch, you've already failed them. And every single rehab facility in the community has probably, numerous couches. And so, from the get-go, from first principles, that facility with no open space, like a CrossFit box, is not going to deliver competent movement therapy. And the other, every single staff member that I employ to deliver functional therapy is either an Olympic weightlifter or a CrossFitter.
That's amazing.
I've tried to hire staff that have not been involved in CrossFit or not passionate about CrossFit or not passionate about movement, and they just cannot do it.
Doesn't fit.
So it's almost like when I put out a job application, I'm not worried about honors degree in exercise science or pathophysiology of biomechanics. Or I want to see their resume saying competed in the last 3 CrossFit Opens.
Yeah,
that's
that tells
the
you a
big
lot.
goal. That's the big gold star for me, because I know their mind is focused on biomechanics, and then I can teach them. It's very easy to teach them the rest,
Sure.
all of the clinical stuff after that.
Yeah, well, I think it's so beautiful how you really are putting into practice when we talk about in CrossFit this sickness, wellness, fitness continuum, and you have, the ability to take care of patients with surgery if that's what they need, but you also have the ability to sort of address their root cause with movement, addressing their movement dysfunction, and then when they get better and they're moving better, they can start adding intensity and doing CrossFit as a way to stay healthy and prevent themselves from developing those symptoms again. So do you have a lot of patients, say after they finish the 8-week program, do they then start working out in the box or start doing CrossFit on their own?
Oh yeah. I mean, so we sort of outgrew our hospital facility, just with patients staying on and becoming athletes.
Wow.
And so it started to displace the space available for patients.
Okay.
And also you got to remember, like when patients come in and they see the CrossFit sign and they go, oh, what? This is dangerous. This is terribly dangerous. My son told me, or my daughter told me, don't ever do that. That's great. So unfortunately, there's still that stigma associated with CrossFit, and I don't think that'll ever be stamped out really. But yeah, that the patients can be scared off by seeing an athlete doing 100 kilogram back squat or something like that, and maybe failing it, or so we then started a second CrossFit Neuro about 3 miles down the road in a 1,000 square meter facility, and so that now serves as our athlete center. But it was actually really fortunate, because when COVID sort of entered the world, we had to sort of restrict people coming into our hospital. So we then started using the large facility, which was great. So yeah, and I'd say, I don't know, 25% of our current membership of just your day in, day out CrossFit membership come from a clinical background.
Wow.
So almost every time I go and do a workout at our box, there'll be at least one of my patients there.
That's amazing.
At least one of my patients, and I did a session with I did a workout with a fellow not too long ago, and he had a history of 20 years of pain, and I was just sort of, I think it was doing wall balls or something, and I sort of just looked over, and I just saw him. He's about 45 or something, and I just saw him take his shirt off. Like, here's a fellow who had lost his confidence, was struggling in life, and here he is doing wall balls to the intensity that he's got to take his shirt off.
Wow.
Because he's just really just in the zone, and he's a CrossFitter now.
Yeah.
And he no longer considers himself a patient. He's now an athlete. So it's as you said, it's that sickness to well continuum that is, it's a natural physiological certainty. It's a physiological certainty when you eliminate the barriers that restrict health. It's like when the Titanic hit that iceberg, it was a certainty that that boat was going to sink. And the same thing with good movement, good nutrition, good sleep, and managing stress. These are what I refer to as the pillars of health, and these are the core values of our box, and medical practice. You give people those 4 pillars of health, and the body just does incredible things. And then you layer on some hard work and consistent training, and then you become a amazing athlete like yourself and stand on the podium 2 times or whatever it is.
Yeah, it's amazing what can happen, right? How do you work with your patients on those other factors that are so important, the nutrition and sleep and stress?
Well, I network very closely with nutritionists who sort of speak from the same textbook.
Yep.
Professor Tim Noakes, Jason Fung. I mean, these are people that I network with, and Gary Torbs. These are sort of like the pioneers of the modern nutrition education, and there are people with the same mindset locally in town. And I just allow them some time with those people. Again, it's just hitting that nutrition pillar and getting people to have that light bulb moment. And when they have that light bulb moment, the body there is no human being on the planet that doesn't want to be healthy. But there's lots and lots of human beings on the planet that put up barriers to stop their body from being healthy. And that's all we have to do. The body will just do its thing. If you eliminate the barriers, that's, as a doctor, that's all you need to do, because the most amazing, you're dealing with an organism that's got this most amazing healing ability that all you have to do is teach them how to not hurt their body, and the body just does the rest.
It's amazing. It's almost, when we get out of our own way.
It's almost a scam, isn't it? Like, because the body's just doing its thing, and we're just telling people, okay, well, don't smoke cigarettes and you'll have healthy lungs. Maybe minimize the pollution that's around your lungs and you'll have healthy lungs. How easy is that? So we just give people the resources and direct them where they need to go, and lead by example. All of our coaches speak the same language, and when patients hear this from everyone around them, it sets in, and we've got them back on the right track to recovery.
For sure. And when you get them in the right environment too, I'm sure just being in the environment of, walking in through your waiting room that's a gym and seeing other people there, and then being a part of a box, and when you are surrounded by the right people who are seeing results and who are like you, it makes it much easier to do the right things and get the wrong things out of your life so that your body can heal itself.
Yeah. They that's why we do like to do the classes in groups. Like a lot of the industry does these one-on-one type of interventions. So you go and see your therapist, and you're in a room by yourself with the therapist, and they're measuring certain range of motion or flexibility, or and you don't get that communal camaraderie of all getting better together. And one of the early parts of the program that we deliver is they're all standing around and talking about their history, and they're saying, I had radio frequency ablation, I've had surgery, I've had injections into my spine, epidurals, facet joint blocks, nerve root blocks, all of this. I take this medication, and you can just see everyone going, oh geez, I do that too, I did that too. And often, when you go around the class, there's 200 years of pain.
Wow.
And then at the end of the class, at the end of the 8 weeks, they're going, why didn't anyone give me this 5 years ago, 10 years ago.
Right.
So it's fantastic that there are, people like yourself who are tuned in to preventative medicine and preventative health, because if we get that message out there widely enough, we'll sort of put ourselves out of business. We'll put surgeons out of business.
Mm-hmm.
So
it sounds like it'd be a success for you if that happened, as weird as it sounds.
Yeah. I mean, that's
Yeah.
one of, I'm a member of our Spine Society in Australia, and I sort of say, well, we could all be put out of business by effective rehabilitation.
Mm-hmm.
But at the moment, there's just too much rehabilitation that is not hitting the nail on the head.
Mm-hmm.
And that's not to say that there's anything wrong with someone doing Pilates or core strengthening or going to see a manual therapist and receiving some adjustments.
Mm-hmm.
But if you don't hit that fundamental nail that's sticking up out of the floorboards,
Mm-hmm.
and you're sort of missing it all the time by doing these other things, then you won't improve, and the global sort of ubiquitous problem of back pain will continue to remain, and it's currently statistics are showing that the prevalence is doubled. It's
Wow.
doubled over the last 25 years. So even though these facts and figures are staring us in the face, none of the industry is sort of turning around and saying, well, we're doing a really, really ordinary job here.
Mm-hmm.
And I've submitted a few articles to physical therapy journals and just trying to put this forward and it's really difficult, because
Mm-hmm.
when I hear back from the editors, they sort of write back and say, so you're saying that such and such therapy, which is 80% of our readership,
Mm-hmm.
is of limited value? Well, I said,
It's hard to hear. Yeah.
Read it how you want, but it's, do you want to be accountable for your outcomes, or do you want to just keep paying off the mortgage?
Mm-hmm.
And so it's I'm never surprised when the editors say to me that we won't publish your article.
Wow.
And so it has to happen from the ground up, a little bit of a
Mm-hmm.
grassroots approach. And people, the patients are the biggest sounding boards. The patients are the biggest advocates for functional therapy, just like CrossFitters are the biggest advocates for CrossFit.
Mm-hmm.
They know what it
works.
does for them.
It's life-changing.
They know what it does for them. But when you're going against the grain, when you're going against the industry trend, it's quite difficult. And we know that with diet, we know that with nutrition, it's challenging, because there's a lot of commercial and vested interests around food, and so why isn't everybody metabolically healthy? In fact, it's almost the opposite. There's more people metabolically unhealthy. Than healthy. You'd think it'd be easy, right? You think it'd be easy to make people healthy, but yet half the population is diabetic or pre-diabetic. That's insane.
And like you talked about, so many special interests and not enough people really looking out for the patient or really looking out for addressing the root cause, like you have. And I think, what you're doing is so inspiring too, because you're taking someone who has one specific problem, a back pain, and you're addressing that, but you're also making them so much healthier, like we talked about, in so many other ways that maybe are going to prevent future problems down the road, or maybe are going to reverse their diabetes or metabolic syndrome or improve their knee pain. And it's just a shame that people have to get to the point where they have back pain that they need to go see a doctor for before they can get that information. That it's something that we should really be able to help people with in a primary care setting or outside of that, so that, like you said, the majority of people should be metabolically healthy and free of pain.
Yeah, absolutely. And primary care is where it starts, isn't it? it's unusual that a neurosurgeon has to talk about carbohydrates,
right?
and
I bet there's
insulin.
very few of you who are doing that regularly.
Yeah, there are very, and I have meetings with my hospital executives when I walk through the ward, and I see my patients who are already obese and diabetic being fed chocolate cake. I say, hang on, this is a hospital. You do realize this is a hospital, an institute that should hold up health principles, and this is the diet that you're prescribed, that comes out of the kitchen. There's just some profound block that the world has to health, and it is our responsibility, Julie. It is we're the guidance for the world as doctors, and if we don't see that, then who will?
Right.
And I think we all need to sort of take a step back as clinicians and go, okay, what are we doing wrong? Rather than say, oh, we're amazing, we can do this high-tech surgery, and we've got chemotherapy, and we've got these new cancer genes and vaccines, and we've got this and that high-tech stuff, right? Let's have a look at what we're doing really badly, and say, well, truly, 50% of the world is diabetic or obese. Our report card is very, very poor, and take accountability, because if we don't actually start to do that as clinicians, then we're really not doing a good job. We're just not doing a good job, and this is part of that, is recognizing and taking accountability. So, well, we should be able to do a lot better.
So true.
But it's almost too simple, don't you think? It's almost too simple. The solutions are too fundamentally simple for people to sort of go, oh, okay, is that all I need to do? Is it? You mean I don't need to have a super expensive, dangerous operation, or I don't need to count calories, or I don't need to have this, meal plan that I've got to adhere to and plug into my mobile phone app every day. No, just eat whole food,
real food,
and and your body will get better.
Right.
So
we love to overcomplicate things, I think, as humans. We want to make it more difficult than it has to be, or we want the most cutting edge new thing, when in reality, most of these things are the simple solutions that have been around since the beginning.
Yep. The simple solutions. That's it. Keep it simple. And it's, there's a principle called Occam's razor principle.
Yes.
And if you have a very simple solution to a problem, it's highly likely to work. Whereas if you start to have complex algorithms to follow, then it's probably not going to work. So these are tenets of medicine that go back hundreds of years to Hippocrates. One of the Hippocrates scriptures was food is medicine. And if you're talking about pharmaceutics, the safest, best, no side effects pharmaceutics is good food.
Good food, that's for sure.
And then you can put all that other stuff in the rubbish bin, because you just don't need it. And I see people taking supplements and, I've got to have my extra vitamins and this and that. And I say, well, if you're eating a good diet and you're moving well and you're out in the sunshine, which is what we're supposed to be doing, you don't need any you don't need any supplements, right? And you're sleeping well. So
start with the basics. Start with the basics. Well, you are obviously working on so many exciting things, and there's a lot of work to do, as you alluded to, just to bring this to more people. But what are you most excited about when you wake up in the morning right
now? It's always exciting to hear the stories from patients talking about their life transformations like that. That's always exciting to hear, and we get a lot of cards and emails and gratitude. But it's no longer a surprise. It's no longer in the beginning, when we started to have this type of core value, our business model, it was like, oh my God, how did that happen? But I didn't expect that to happen, and now it's sort of a regular thing. That it's still exciting, and that every time I go to work, and every time I go to the box and see patients, it's that sort of keeps me motivated and keeps me inspired. It's really the patient outcomes, and we have a really wonderful community at CrossFit Neuro. I'm sure all boxes do, but there's something very special about the fact that a huge cohort of our patients our membership are patients.
Yeah,
I think that's quite unique.
Sure.
I would love for more box owners. And I know on CrossFit Physicians there are a lot of doctors that sort of are involved in boxes. I don't know how many of them own boxes, but I think that's kind of the way forward in modern medicine. Is this functional medicine approach, where we focus on those core values. And just imagine in every town, just one clinical CrossFit box. The way that could exponentially permeate through society, where you're focusing on movement, nutrition, and the sleep and stress just comes hand in hand with that.
Very powerful.
It's incredibly powerful, and I think that may have been one of the visions or dreams of the foregone owner of CrossFit. I really hope Eric has the same vision. I haven't sort of been involved enough with Eric to see that. I really maybe you can comment, but
no, I think he definitely does, and I think we're going to see a big focus on that. I think it's one of the things, like you said, that makes CrossFit why CrossFit is so special, and is that we have always been focused more on the big picture of health and getting people healthy and community, and it is such a huge opportunity to be able to make that connection between the clinical and then the recreational exercise.
Yeah. You've got are you going to start a box?
I'm not personally going to start a box. I don't think so. But
it'd be amazing.
At least not right now. Who knows in the future?
Yeah, no, it's one of the best things that I ever did with my practice.
That's amazing.
Neurosurgical practice was to integrate a functional training center, and it's very, very satisfying. I think my colleagues look at me, my conventional neurosurgeons go, what's David doing? What's this crazy stuff that he's doing? But you know what? They're now starting to refer patients to me.
Yeah, they see your results.
And they're now starting to, so if they do perform a surgery on a patient, then they go, you better go back and see, you better go to this other neurosurgeon. And so it starts to rate, why didn't you send me to him in the first place? So
it's a start. It's a start.
Yeah. No, it's fantastic.
That's great. Well, I have 3 questions I usually ask at the end of the podcast to wrap up. The first one is, what are the 3 things that you do personally on a regular basis that have the biggest positive impact on your health?
3 things. Well, you know my core values. The quality movement,
Pillars.
Quality sleep, quality nutrition. I would say for me, it's that consistency. Like consistency is the hardest thing. Like every day, just go, okay, I don't need to do anything amazing in my training today, but I'm going to turn up. And that's one of the hardest things to stick with, is that consistent mindset, consistency with your diet, consistency with your movement. I suppose the thing that I'm worst at is managing stress and sleep. So
those are tough ones. Yeah, it's always a balance.
It's a converse answer to your question, but that's what I need to work on.
Well, that's great, because that was going to be my next question. Is one thing you're working on.
Yeah. I need to work on my my chest to bar butterflies.
Okay.
That's oh God, I wish I could get those. I know that's going to come up in the next. I know that's going to come up in the next open, and it's going to be where
chest to bars.
Why are chest to bars so much harder than regular butterfly pull-ups? I don't know. I just don't know. And I've got to get that right. Yeah, and I suppose there's always temptations. There's always temptations to indulge a little bit, but I think if you need to earn that privilege to have those indulgences. Talk about the 80-20 rule.
Yeah.
The 80-20 rule works from a position of health. The 80-20 rule doesn't work from a position of disease. Once you earn that once you regain that health with the 100-100 rule, now you've earned the privilege to apply the 80-20 rule.
That's great. I love thinking about it like that.
Yeah, and so I think maintaining that, keeping it nice and tight with that 80-20 rule, not letting it slip sort of into a 50-50
right
is one of those things.
There's that consistency again, just being consistent with that percentage.
Yeah.
All right, well, you already answered my second question. So the third one is, what does a healthy life look like to you?
It starts in the home. It starts with my family, my two children, just waking up every day and having brekkie with them and setting the day off with positive mindset and smiles, and that's kind of what drives me is just that happiness at home, and then it just sort of flows out from there, I suppose, with everything else, and then coming home to it as well. That's what it's all about, is that quality of life. And I think you can't beat that when you've got a happy home. So,
I love that. That's beautiful. Well, thank you so much for this conversation, and thank you for all of the work that you are doing and the example that you are setting, and how the model that you have, I know, is already inspiring people all over the world. And I hope that we see this on a more widespread basis, that this becomes our standard of care and not something that's an exception. So thank you so much for all the work you're doing.
Yep, with collaboration, similar mindsets, people like yourself with a really wide platform, pursuing health. It's fantastic. I watched quite a few of your shows, so you're doing a fantastic job as well, Julie. So congratulations on that.
Thank you. I appreciate it.
Thanks so much for tuning in. If you enjoy listening to the podcast, please consider subscribing and giving it a 5-star rating on iTunes. It really does help to get the word out to more people.